Welcome back, Chronics, and thanks for joining me. Today we're just talking about all the stomach complications that we can have. I listened to this amazing talk by Dr. Aziz, who's in London, because of course he is, and he lays it out. I'm going to lay it out for you. This talk was part of a series about emergency care for people with EDS. Going forward, when I run into other stomach issues other than the one that I'm dealing with right now, I'm just going to hand this to them and be like, who volunteers to go through this list and check off what it is and what it isn't? Let's start with the first one. Hernia, number one on the list. That's what I have. I have a hernia. Yeah, I've had it for 6-7 years now. But Tuesday I go see the gastroenterologist again, and hopefully I'll get the referral to that surgeon or I'm going to lose my mind. No, I'm serious. I'm going to lose my mind. Visceroptosis. It's when our organs are hanging low and they're swinging to and fro because everything is so loose. Our organs can shift down lower into our abdominal cavity, causing pain, bloating, obstructing arteries, all that fun stuff. So just got to make sure everything's where it's supposed to be. There can be anatomical abnormalities like something called a rectocele. Basically, part of your colon kind of extends and forms a pouch, and that can be treated with pelvic floor therapy. This one's my favorite. Overflow diarrhea. That's right, you heard me correctly. It's actually constipation that then causes diarrhea. So it's like a 2-for-1. It's great. And I guess this is really common with us. So hence why, when doctors are like, are you constipated or are you not constipated? And you're like, I don't know. Kind of switches back and forth. Mast cell activation syndrome, MCAS. I do a whole episode on it, so check that out. But it can be treated, and this is what they treat it with. Abdominal migraine and cyclical vomiting syndrome. This is what I was told that I had when I had really bad pain, but they said there's nothing that can be done for it. Not true. There is something for prevention, and then in an emergency, this is the treatment. Vascular entrapment syndromes. There's a few. We'll go over all of them, just in case. Superior mesenteric artery syndrome. I guess we have this fat pad that we're supposed to have to protect our abdominal aorta from being constricted. If that fat pad disappears, it's going to trap our duodenum and cause a problem. Something similar when there's an obstruction is called nutcracker syndrome. And that is when the left renal vein gets entrapped. And there's another condition called May-Turner syndrome. And that's when the left iliac artery is compressed from the right iliac artery, which can cause a lot of pain and congestion in the pelvis. Median acute ligament syndrome, MALS. This one is actually more common for EDS patients. Basically on us, this ligament can move down and compress the celiac artery, causing major pain. Abdominal aortic aneurysms. I mean, they should really be checking everybody for aneurysms everywhere, am I right? So, normal person problem. Abdominal bleeding. Also a very normal person problem. It looks like bruising. So where that purple would come up, it's just bright red. I know, that was a lot. These can happen, they're not all gonna happen, but everyone should be aware that they could happen. Thank you again for joining me, Chronics, and as always, hang in there, stay strong, don't give up, and don't take crap from anyone. I will see you guys next time.